So I'm really overwhelmed and afraid in this room because this is a group of techies to whom I actually lost my job. That is really the theme of how my journey started in Narayana. So before joining Narayana, I used to work with Wipro and before that with Unilever. And one of the most prized possession of a finance person is their Excel sheet. We thrive in that. And that's really our power. If people need to know the revenue number, they need to call us. If people need to know where the profit will finish, they need to call us. If people need to decide what profit they want to finish at, they need to call us. So it was that power that you draw from your Excel sheet. And when I was doing my handover with the outgoing CFO with Narayana, and I was asking him saying, where are the Excel sheets? And he was saying, there are no Excel sheets. Real, true story. And it was like after 20 years of career, I'm taking a handover as the CFO of a listed company with no Excel sheets. I thought maybe he was just setting me up and I'm going to really struggle. So then I came back and I told the teams, okay, now the CFO is gone. I've taken over. Now give me the Excel sheets. And they said, no, but it's all there on the BI. So that's how my journey started in Narayana with no Excel. And it may be simple for all of you because you are the guys who are taking away our relevance. But it's very intimidating for people like us who have grown in trying to manage Excels and PPTs. Then came our the OC reviews, as we call. And normally for OC reviews, finance prepares these elaborate presentation, almost 10 days of Manrega program for finance. Manrega is the Mahatma Gandhi Rozgar Yojana, which is run in the villages to keep people employed. So 10 people will sit around some 10 into 10 place and pluck the same grass. So that is really what finance does for the first 10 to 15 days of the month, taking data from multiple sources and making the PPT look the way it looks and feel very important in the process because every single business leader will leave sales, will leave production, will come and sit next to the finance person to see what PPT he or she is making. So where are the PPTs? There was no PPT because the entire review happens on BI. And so no PPT, no Excel. And really the biggest place where, really took away the entire cream of the job is there was no firefighting. I mean, you have to have numbers that don't reconcile. You have to fight to make something happen. I mean, you really have to do things like that. And it didn't exist. So I was like, where have I even landed? But that's really how my journey in Narayana started. So the way our data tool works, it's a very comprehensive tool. And see, I'm not trying to promote our data tool here, but it is more about how our journey was. So let's say when we want to talk about our revenue, it gives us in a dynamic way revenue forecasts. It gives us what we did. It also allows us to understand where shortfalls came. So then we know, for example, in which department, which hospital, maybe which category of beds, where we had shortfalls, where we have activities to do. One of the things in healthcare is that it is very difficult to influence revenue. Now, revenue is when patients walk in and you are able to drive. But for us, what is very, very important is one, the processes, the discipline on the processes so we can ensure cost as well as quality is ensured. That's what is it's a bigger focus for healthcare. So what we do for us, cost is extremely important. And maybe at this I should take a small detour and talk about Narayana. How many of you know Narayana Health as an organization, as a healthcare? Okay, many of you. Thank you for that. So we are a listed company, and we were started by this visionary heart surgeon called Dr. Devi Shetty, who was he wanted to democratize healthcare in this country. He was very sad that there were so many people that had to lose life, not because they didn't have the treatment, but because they couldn't afford it. So Narayana was set up as a socially leaning organization which actually had brought down the cost of heart care to start with by implementing the factory model. So this is like the pre-Gen AI version. You know, when I would have delivered the same lecture 10 years back, we'd have spoken about the total productivity management and factory model and process efficiencies. And that's really what Narayana did at that point in time. And given that I only have 20 minutes, if you really want to understand more about Narayana, there is a very interesting Netflix episode on Narayana. It is called Surgeon's Cut. Maybe you can go and know more about it. But what we really learned when we went through this journey of cost and making healthcare affordable was that there is no way you can manage a process of that complexity and that efficiency that you need without having data working for you. So I spent my entire career in Unilever, FMCG, and also part of Wipro FMCG. And one of the things we learn in FMCG is that you will always have some inventory write-off, and that's a typical thing that happens because you cannot manage inventory to that kind of precision. When I came into Narayana, I realized that we hadn't taken a single inventory write-off for 3 years. And we had no right of proposal on the table that year end also. And one of the reasons why we could do it was the power of predictive AI, where the AI actually, the Meda tool actually tells us the inventory which is about to expire. Especially in pharma, it is very important that inventory is used far before expiry. You can't even use it close to expiry, unlike other products, and you can't recycle also, like we do in other industries. So which means it's very important that the timing of when the inventory will not get used in that unit, therefore you have to move it to another unit, or you have to use it as an alternate consumption. Those strategies are very important, and therefore it was very important for that to be built into the system. And that's something that Meda delivers for us. Like that, there are various KPIs that Meda delivers. We have about 60 use cases in operations. We have several use cases in finance. My budget process is running right now. At every level of detail, the entire budget runs from the system. I have not had to actually collect any data, but more importantly, what it allows me to do is to do a scenario. See, for a finance, for a CFO, when you are talking to your CFO, the first thing you need to keep in mind is we may talk about knowing technology, but we don't. We don't understand. We just show off that we understand. So many times when you're telling things to us, some of it is just going above our head. Okay, so when you're talking to us, you first need to simplify it to what outcomes we are looking for. So for me, for example, if I'm doing a budget process, I'm looking to know what scenarios are the risks for me. What if this goes down, this goes up? How will the outcome look like? If this risk gets factored, if my costs don't turn out the way I'm predicting, or where do I have, if assuming I'm targeting to get to a certain number in terms of margin, if I say move my consumption here, if I move my manpower cost in this unit at this level, then how my overall number looks like. So I want to be able to interact. But I will never understand that that level of interaction is not possible with a simple, it's not like a jadoo ki peti where you say, change this, it comes out. You guys have to put a lot of logic at the back to make it work. I'm not going to understand that. So I think what would be useful for you as you're interacting with dumb CFOs like me is that you start with what am I looking to influence and what am I looking to modify, and then you build the tool. I think that's something that the tool has been able to do for us for our budget. The biggest use cases we have is in supply chain because we are a cost-effective player. So therefore, it was very important for us to build extreme efficiencies in supply chain. We have now started building a lot of use cases in marketing. Again, this is a very important area for businesses, given that, see, traditional marketing used to be that, again, going back to Unilever, Lever Humes used to say that, I know that 50% of my marketing spend is a waste, but I just don't know which half. So it is like that. So historically, marketing has always been that you throw money onto something and you make some fancy ad, and that ad runs, and then you feel happy that, okay, maybe because of that somebody bought my soap. We don't really know what works, what doesn't work. But today, thanks to the way digital marketing works, there is far more precision and far more targeted marketing that you can do, which means there are much more KPIs that one can track. If really, if our marketing head, I mean, he's a very nice guy, I'm exaggerating, but if he had a wish saying, oh, I hope this person meets with an accident on the way, that is me. Okay, that much amount of pressure I put on him in terms of KPI for marketing. And really, with the way, one, of course, your Google My Business and the entire SEO is far more codified than what we are used to. So it is like this, no? Suddenly you have someone who is starving for food, and you let them into a room full of chocolates and cakes, and that's how information is in marketing right now. For finance people, first we don't understand most of these parameters, but there's so much data available. So we have been able to build a lot of dashboards in marketing, but it has also enabled us to manage ROI. For every single program, we are able to track ROAS, and for every single investment, we are able to track ROI. So those are, again, very good use cases we have been able to create. Now, if I go take a step back and see where the journey began, it is like how it began for everybody. There was very poor data quality, multiple applications that don't talk to each other, suboptimal analysis, enormity of data. I think the challenge of today, see, when I started my career 25 years back, the challenge was that we did not have data. The challenge is now the ulta. It's like nowadays they say there are more people that die of obesity than of starvation. So it's the same with data right now, that you have so much data that you really don't know what to look at and how to look at, and we want to keep ourselves all gainfully employed looking at everything. So in terms of synthesizing what needs to be done with this enormous amount of data is really another challenge that, like every other organization that you all would have been part of and have gone through this journey, so I don't need to elaborate this. So what we did was, over a period of time, we built end-to-end coverage of all aspects of business when we started our journey with data. I'm not going through the journey per se, because it will be like preaching to the choir to all of you, because you all are already part of organizations where you would be doing this. So I am more focusing from a user perspective how we have looked at it. So one realization we had was, the minute you have a manual bypass, then everything bypasses. The minute you allow somebody to look at certain parameters outside of the BI and certain parameters in the BI, then they expect somebody to then put everything in Excel and give it to them. See, end of the day, everyone is short of time. And the minute you create a process which is bypassing your regular process, then everyone wants to take that. So we built every single use case that we needed to use for decision making into BI. And then we said, if you need something more than this, you justify why you need it. Because if you can keep building thousands of analysis paralysis and not reach anywhere. Then came the last leg in the problem, which was that even though we had so many, Medha and everything in the system, etc., the Excel sheet still remained. We could not put every data into the ERP or the HIS, or everything could not be codified. I did not know, now of course we have built a OT module, but when we started, we did not know what time the OT was being started by the paramedic, and there was one manual register in which he would write, I started the OT at this time. So how do I codify that data? I can't buy some 5,000 handheld devices and give it to 5,000 nurses saying, whenever you start the OT, press. It will take time to make that kind of journey. So then we invented YASA. YASA is nothing but an Excel sheet sitting behind Medha. I mean, it's a more complex solution. If you speak to our BI people, they will explain. It's not so simple. But for us, from a user point of view, anything that we can't get from any systems that we have to manually put in, we tell them that you put it into YASA and then the BI will pick it up. The advantage of doing something like that is that some of the data, till it gets digitized, you can have a manual infrastructure to bridge the gap. But then you have a checklist of what are the gaps you need to bridge, and you can bridge it over a period of time. So that really allowed, called, say for example, nursing checklists. There is a procurement tracker, which is when I send the PO to the vendor and when the vendor responded with his first quote and second quote. And these are all digitizable, but every digital intervention is a cost. And cost not just from a technology build point of view. See, most of the time, technology people think that the cost of technology is the build cost. Absolutely no. Build cost is the smallest cost. The change management is the biggest cost. Because people don't like change. People don't like moving to a new system. So driving that change in the organization requires enormous leadership bandwidth. And therefore, we have to focus leadership bandwidth to maximum value. So we created this YASA where we put on stuff that we cannot immediately automate. So at least all my output measures come through swiftly. So we have multiple use cases that run on YASA for us now. Now, for any data program to be successful, the top leadership role is the key. One is setting the vision. We cannot, if we are leading, and all of you are leading tech projects in your organization, but we need business leaders owning tech projects, business leaders taking leadership roles in tech projects, do roles in the tech team because they understand business context and there will be ownership when it goes from them. And the other thing is not giving up. Every single OC review, somebody would get up and say, that number is wrong, like that. So we have to then stand up and say, oh, it's okay, so be it. We will look at the wrong number until you figure how to correct it. But we will not take a number which is outside of the system. And keeping on asking more. This is the last one is very important. Every rupee invested has to pay back. Of course, areas to watch out for. I don't need to tell this group about areas to watch out for: quality, clarity, security, source system maturity, which you have to build over time. Our data analytics program has been recognized as our biggest differentiator in running our low-cost model. We are the lowest average revenue person in the top 5 listed companies in the country. Our average revenue is maybe 60% of our next competition, but our ROCE is 25%, and we have delivered more than 17% return to our shareholders from the time of our listing, and our profitability is greater than 20%. Our EBITDA is greater than 20%. We are a reasonably good PAT company, and that happens because we are not focusing on extracting the maximum out of the customer, but how do we run an efficient operation, and what we run with our data systems is a key enabler to that, and this has been recognized in multiple forums. There is a Harvard case study on Narayana. So it was very interesting for me when few of my friends from Unilever or other companies I worked with, when I tell them I joined Narayana, they say, oh yeah, I know Narayana. And I get very surprised saying, how do you know Narayana? We are one unknown, nondescript hospital in India. And they say, no, I did this executive MBA in Harvard and I had studied your case study. So that level of differentiation we have been able to make in our business operation because of how we've been able to leverage technology and data. Finally, this is the CFO's favorite slide, which is that every single dashboard has to have an impact. So every time the Medha team delivers a dashboard, we ask them to show us an impact measurement, and we ask them to take us through either it can be manpower saving, it can be revenue improvement, it can be cost reduction, it can be certain business matrices like quality going up. I have only 1 minute more, so I think they're moderating the mic a little up and down to tell me my time is getting over. So I should get to my last slide, which is essentially questions.